Good morning, good afternoon, good evening, everyone. Welcome to today's WHO Regional IPC webinars for the Western Pacific. Thank you for taking your time. We have a great sessions ahead. We are very excited to have two countries sharing their experiences from our regions. Our goal today is to share lesson learned, discuss and strengthening IPC efforts across our regions, and foster collaborations for mutual learnings. So let's get started. My name is Shogo Kubota. I'm the coordinator for Maternal Child Quality and Safety Unit here at the WHO Western Pacific Regional Office in Manila. And IPC, Infection Prevention Control, is one of our spearheading programs for quality and safety. I will be moderating today's session together with Dr. Zhao Li, our technical officer for IPC. To kick off our session, we will begin with a focus on high-level commitment to IPC. As you know, successful IPC, infection prevention and control, requires not only technical expertise, but also strong support and commitment from the leadership. So we would like to first hear from our WHO senior leadership about the critical roles of commitment in driving IPC initiatives at the national and the regional level. We are honored to have Dr. Suzy Mercado, Acting Regional Director and Director of Program Operations of WHO Regional Office for the Western Pacific. So, Dr. Suzy, the floor is yours.
Okay, thank you very much. Let's see. Okay, I'd like to welcome everyone to this webinar that's brought to you by the Division of Health Systems and Services to a very much needed webinar and kicking off, I think, a series of discussions on infection prevention and control. So I'd also like to welcome all those who are watching on the playback. I understand this is going to be recorded and can be made available to everyone. All right. So every year around the world, hundreds of millions of patients and healthcare workers face devastating consequences from preventable infections acquired during healthcare delivery. These healthcare associated infections, or they're also known as HAIs, pose a significant risk not only to patients but also to the family members, visitors, and the health workers themselves. In many cases, antimicrobial resistance exacerbates these infections and makes them harder to treat. While HAIs are responsible for increasing global disease burden, their impact is felt most acutely in low and middle income countries, or even in high income countries where you have conditions that are not up to par. In many of these countries, HAIs drive high mortality rates. Urgent action to improve infection prevention and control can save lives and fortify health systems. Global studies have found that 35 to 70% of healthcare associated infections can be prevented through infection prevention and control, or IPC interventions. When coupled with antimicrobial stewardship, the burden of antimicrobial resistance can also be significantly reduced. The tools for prevention are within our reach. And I know that many of you are familiar with the IPC interventions that include the usual things: hand hygiene, standard precautions, personal protective equipment, environmental hygiene, disinfection, sterilization, including routine healthcare associated infection surveillance, which is very important inside institutions, and the use of data to improve IPC strategies. These are the foundations of safe healthcare. We must ensure that there is adequate infrastructure. I think this is a very important point. We can preach and say these things are needed, but if a hospital doesn't have running water for 24 hours or sanitation, or healthcare workers are not familiar with waste disposal and basic hygiene, the objectives of IPC will not be met. Every healthcare interaction must embrace infection prevention and control as an essential part of providing high quality care. So this is not just about infection control. It is about providing safeguards, providing good care for every patient, every caregiver, every community, and every family. In the Western Pacific region, infection prevention and control is central to daily healthcare delivery, but is especially important in emergency situations and for emergency responses. Much more than a crisis management tool, infection prevention control can drive quality improvement. And many facilities that are able to implement quality improvement circles have in fact started with infection prevention and control. We recently published the infection prevention and control systems in 6 priority countries in the Western Pacific region. So this is a document that is available to you. And this regional report provides a detailed snapshot of infection prevention control in 2023 within health systems across Cambodia, the Lao People's Democratic Republic, Papua New Guinea, the Philippines, Solomon Islands, and Vietnam. So WHO is working with partners with ministries of health to implement good standards for infection prevention and control. And today marks the first session of this webinar. It's first because there should be more to come, bringing together experts in infection prevention and control, patient safety, antimicrobial resistance, water, sanitation, hygiene, health emergency response, and communicable diseases. I welcome Dr. Virya Koy from Cambodia's Ministry of Health and Dr. Morioka Shinichiro from Japan's National Center for Global Medicine as the esteemed panelists who are going to share their experience and their wisdom with everyone. And we hope that this will continue to be a good platform for sharing information and from improving the way we serve and work. Thank you very much. Thank you.
Thank you, Dr. Suzy, for your encouraging speech on leadership commitment. Now, let's take a look at IPC from a health systems perspective. As you all know, effective IPC cannot be achieved only by a collection of isolated actions, but it's about building a strong health systems in place. So I would like to welcome Mr. Luis Vinales Torres, our Director of Health Systems and Services at WHO Western Pacific Regional Office. Luis, the floor is yours.
Thank you very much, Shogo. And again, good afternoon, good morning, good evening to all esteemed participants to this first series of webinars that we are putting together for you on IPC. Let me reflect on few areas and answering the point that was raised by Shogo. What's the role of IPC within the broader health systems and the journey towards universal health coverage? We know when we talk about IPC or patient safety, we talk about hand hygiene, we talk about PPE, the use of PPE, we talk about environmental cleaning, we talk about sterilization. We are familiar with these functions and tasks. But what's the link between the broader picture on systems and UHC? Definitely, all these tasks and functions are part of the broader quality goal that we are all trying to pursue. And let's recall the Lancet paper that was produced 7 or 8 years ago that reminds us that more people dies of lack of quality than lack of access. So definitely quality, and therefore IPC is part of the function that we need to be pursuing to progress towards UHC. Also, we should kind of move away from a verticalization of IPC and even quality discussions and try to embed it on many parts of the health systems from when we are training officers or future health workers to all the way to ensure clinical quality at in facilities. I want also to, there's also this expectation that IPC, it's a task allocated to few people chasing others, no? And one important message that we are trying to pass is that this goes from the very top of the systems to everyone delivering services. The top officials needs to secure budgets, needs to secure their leadership, needs to put that in the agenda in a continuous way, while we also need that the health workforce are being trained, and the changes even at the cultural level are happening at facility level. The main message here is it's everybody's business. The second point that I would like to do is, okay, what is IPC in actions? And I would like to divide it in two big areas. One is the hardware and the second is the software. We need hardware solutions. DPM was mentioning about having running water. There is a need to have these capital investments and supplies that needs to be there. This has to be taken care. But also this is the software part of the story. It is the skills, but it's also a culture. Everybody uses the bell in a car because it's used to do it. And this has been a result of a changing culture, in introducing a safety culture. So we need to move in the two fronts, improve the availability and the capital investments for the hardware part and the software part. The next point that I want to make is when we do IPC implementation or IPC is strengthening, I think also we should divide it in two main areas, upstream and downstream. And this is how we are organizing ourselves at WHO, when we are trying to support our member states. On the upstream part, we need to ensure that there is policy awareness and there is conceptual clarity and strategic thinking and a strategic plan on IPC. It's important that we understand all the components, but also that we strategically can locate it within the health systems and how to do that. This is normally supported by stimulating and helping developing strategic plans. Second is downstream. The reality happens on the ground. We need to changing culture. It means also understanding context, understanding behaviors, understanding facilities. There is a lot of need and work to be hands-on and work at facility level. So the downstream part of the story cannot be forgotten. We have worked very hard in the recent few years analyzing a lot of documents. DPM was already sharing few of them, but we really need to aim collectively to increase our action and our reach, and really makes the difference where it matters down at the facility level. These webinars, as I said, as we said, will be only one. And why we have suggested the development and the preparation of these webinars. First is because we really believe and WHO has a role to serve as a platform for cross-country learning. I think one role that we need to facilitate is we are bringing academics, we are bringing policymakers, we're bringing practitioners together to learn. There is a big deal that can happen in learning between countries and learn the best practices. And for that, I want to stimulate everybody's active participation. We really hope that this transforms into a community of practice, online community of practice, where we create these like-minded people that really wants to move the needle on IPC, and we build on that. And with that, I would like my last words to thank you first, my team, for your hard work putting together this first and the forthcoming webinars, including our IT colleagues that sometimes we neglect. And also to thank all of you for investing your time into this very important topic and be with us. Thank you very much. Back to Dr. Zhao.
Okay, thank you very much, Luis, for showing this broader context of IPC and justifies all the participants in a broad in scope range of participants for this webinar. So let's now shift to a specifics of our regional IPC webinar series. So this platform serves as a vital space for sharing knowledge, addressing challenges and opportunities, and learning from each other. Let's hear more about the objectives for today's sessions and also how that fits into the broader series. And we hope to make this a collaborative learning experience, and your input will be the key. Okay, so I would like to ask Dr. Zhao Li, our IPC focal person, to provide an overview of the series and also the concept of IPC regional community of practice. Over to you, Zhao.
Thank you very much, Dr. Shogo and Luis, for your supportive speech. Hello, everyone. So I'm now going to give a quick overview of this webinar series, and I hope you will get excited just as me and my colleagues here. So, okay. I will touch very briefly on the background because I think it has been very well elaborated by my colleagues and leadership here. But I would like to show you a photo of WHO as a region. We cover 37 countries and areas with more than 1/4 of the entire world's population. So when we talk about establishing this regional IPC webinar series, the region is the definition that we're showing to you right now. So as you can see, we're really hoping that we can build a sustainable network that is growing, that is made for IPC professionals, public health society at large, across the region, and together we will be at one team as a community of practice across the region. And the webinar timing is basically chosen to cater to all of us in this region. And actually, we can already see quite a lot of Pacific participants joining from your late afternoon. And very happy to see you guys. And thank you for coming. So the objectives, as Dr. Shogo has already mentioned, maybe what I would add on this is that we're really hoping that this webinar series will reach all professionals at different levels. We're looking at you from a hospital, from healthcare facilities, whether as a IPC professional, a nurse, a physician, a pharmacist, a program manager, and all the way to national level, where we'll be joined and by Ministry of Health focal points. We hope that this webinar provides the opportunity for us to share and discuss the IPC challenges that you may have met, and we would like to carry out through either structured discussions or semi-structured, more importantly, to have this peer learning and experience sharing, because again, you guys implementing in the ground, you have so much expertise and good lessons that you can share and let us learn all together. So we hope that this could help strengthen the country level leadership in terms of the program implementation across all the relevant sectors and accelerate the adoption of evidence-based IPC interventions by connecting with all of you from academia, program management, development sectors, and all different fields. And we will be supplying you with the latest WHO guidelines and publications as well. So the approach is that it will be a series of webinars where we will have virtual sessions with our regional and global experts who will be coming here, give presentations, and we will have our country experts showing the case studies. And we hope to continuously engage with you through webinars, but also network emails, newsletters, and social media, and etc. Open to new ideas as well. We're at the end of this session, we will be having a Mentimeter where you can give us your suggestions. And this whole idea cannot be achieved by one person or one team or even one unit and one division. And that is why we're joined together with all the support of our regional team and colleagues from different experts areas. And I would like to take this opportunity to introduce them to you. These colleagues will be the steering the body of this community of practice, guiding the discussions and also supporting the engagement and collecting feedbacks and be our resource persons. So if you allow me, here is a list of the proposed webinar session topics. Today, we're touching the first one, which is strengthening the health systems for sustainable IPC, joined by country case stories from Japan and Cambodia. But also in the future, we hope to address potential topics such as bridging the gap from guidelines to implementation. As Dr. Susie mentioned earlier, the regional scoping report has found a significant gap in terms of translating the national strategy and policy into a budgeted action plan, and from action plan goes into the implementation in the field with measurable outcomes. So these are the things that we have identified already as a priority, and we would like to gather your experience in this session. Another potential topic is about hand hygiene. As many of you are professionals in this sector, you are probably have been leading the May 5th World Hand Hygiene Day, and WIPRO also carried out a series of campaigns at regional and country levels. We are, I think you are aware that hand hygiene sounds like an easy behavior task, but it requires a series of motivations and infrastructures and supplies, knowledge, and most importantly, to make the practice happen. So we might be interested in listening about behavior insights behind the hand hygiene to understand why people are still not yet fully compliant with hand hygiene, and knowing this is one of the most cost-effective measures of all the other measures to support and reduce the HAI risks. And as many countries in our region, we're fortunate in that sense that have been really advanced in testing and advancing new technologies such as artificial intelligence in improving IPC and supporting HI surveillance. We are aware of a lot of interesting inventions, but also research papers on that. And then we would like it to be a topic for peer learning as well. So these are the approaches that and potential titles. And now, if you allow me, I would like to show our regional team and colleagues sitting at the regional office. So together with me here, if we can have IT supporting the camera, we have Dr. Tiara Mathami Nisa, who is covering HIV, TB, STIs. Thank you very much for joining, and she's from the Division of Disease Control. We have Dr. Takeshi Nishijima joining us, who is the regional lead for AMR, and also our colleagues in the same division. We have Ms. Augusta Shibata, who is the focal person for patient safety, and obviously very important and relevant to IPC. We have Dr. Samuel Chong from Health Emergency Team. I understand he is online. So if you can open your camera, Samuel, we'll be happy to show you to the public. And Ms. Jin Won Yi joining us from Korea in the ACE Center in charge of the WASH and IPC, WASH for healthcare facilities. And here below, you see our hosting team led by Louise as our division director, and Dr. Shogo, and Mr. Gato Borrell, the communication talents behind all these, and Ms. Irene, and actually Judith in our team for all the admin support, as well as our capable IT team. I don't know if you can put a camera towards yourself, but we're actually having a full house here. So thank you very much, regional colleagues. And next is our core group members on the country office level. And this is no way an exhaustive list, but this is, I just wanted to show you that these are all our amazing colleagues on the country office of WHO that works closely with Ministry of Health and healthcare practitioners. You might be familiar with many of them. So if you allow me, Miss Melissa Zhao and Miss Dr. Madeline Sava from Papua New Guinea country office, Dr. Rashka Grander and Dr. Tracy Young from Fiji office, and actually also supporting liaising with 22 Pacific Island countries as well. We have Boniswa and Dr. Sogi from Solomon Islands, Dr. Zeti covering Malaysia, Brunei, Singapore, Dr. Onyong Ko from Philippine office, and our colleague JP Tolonete, and also from Philippine office, and now in our regional team. We have Rick Han from China and Dr. Vanda from Cambodia and Anna from Laos, and the list goes on. And last but not least, our collaborating partners and friends here. We see Miss Margaret Leon, for example, the IPC lead in Pacific Community SPC. I believe, Margaret, you're here today, so please feel free to open your video. We have a lot of colleagues, really amazing clinicians and IPC professionals, as you can see across the region, from Asia countries all the way to Pacifics. So thank you all for being our precious partners and friends. So with that, I hope they give you an overview of how we conceptualize this series of webinars, and then we hope to have this journey together with you. Towards the end of the journey, we're proposing a certificate that can be issued by WHO for those who have joined the whole series of webinars of no less than 80% of the total sessions, as a way to acknowledge your time and contributions, but also most importantly to document the precious journey that now we're forging together. Of course, Louisa, I need your further guidance on how to process it in WHO, but that's another topic. But we'll do our best, and really hope you will be sticking with us for the whole year, this year and next year. Now, we would like to end with a quick RD's tweet by Dr. Saya that he said, we really need to invest in infection prevention control programs, and let's continue to work together. So thank you, Dr. Saya. That's the end of my presentation. Now, since Shogo hand it over to me, now, we're very thrilled to have two country experts sharing the working IPC today. First, let us welcome Assistant Professor and Dr. Khoi Veria from Cambodia, who will share the country's progress and lessons learned in advancing IPC. So Dr. and Assistant Professor Veria is the Deputy Director of Department of Hospital Services of Ministry of Health of Cambodia. He's currently the postdoctoral fellowship at Chulalongkorn University, the Chief Nursing Officer and Nursing Midwifery Focal Person in Cambodia, and also for WHO. Dr. Veria is a leading expert in nursing and IPC in Cambodia. He has a PhD in nursing science, played a key role in developing national policies on IPC and healthcare quality. He's actively engaged in several global IPC initiatives and has contributed to various international nursing projects and publications. So Cambodia has made significant strides in strengthening IPC at the national level, and we're looking forward to hearing more about your strategies, challenges, and successes. His presentation today is titled Cambodia's Progress and Lessons Learned in Advancing IPC and Strengthening Health Systems. So without further ado, Dr. Veria, over to you, please. The floor is yours.
Yeah, thank you so much, Dr. Chowli, and I would like to express my sincere thanks to the WHO Regional Office who organized this wonderful and important session webinar in terms of the IPC that is very important for every country and everyone, for healthcare workers and also for patients. So, and I would like to express sincere thanks also for the WHO team, the whole team, who support this, make this event to be happen. So I would like to thank you, Dr. Charlie, also for your introduction. And we have like a Dr. Sukuku Bota, coordinators, maternal child health and quality and safety, and everyone there. Sorry. Then I would like to just only scope for my presentation. I just have only 3 points. One is the IPC program in Cambodia, and how is some success factors that can be we work in Cambodia. And the last point is about the challenges that we face in also. So I'm coming to the first one. There's IPC program in Cambodia. We have the National IPC Task Force chaired by the Secretary of State, and we have a technical working group. So we have a lot of team that working for the IPC Task Force, and then this IPC Task Force endorsed by, I think, 2023. So we equip with many key important people who involved with the IPC. And the second one is about the National Static Plan we did in 22, I think, approved in 22 and 2030. So this is a national IPC guidelines. So we working on revise. We have like a different version, but we revised in 2022. And after that, we provide based on the IPC national IPC guideline, the updated one. Then we revised the IPC training curriculum also. So I think about the IPC training, just as this year, we get support by WHO in Cambodia, not just only in-service training, but we are working for the pre-service training also. So we have an IPC committee, we set up the team, a healthcare facility at different level. So from the nationals to the lower CPA 1, where the IPC committee is there, sit there. And we have the role and responsibility also. We have the healthcare associated infection surveillance program, and we collaborate with WHO in Cambodia and with our partners, other partners, and also we collaborate with also some national hospitals and provincial hospitals. So we select just only working with the 11 hospital first. We want to see whether our surveillance programs can be effective in Cambodia, because I think we can start in 2023, 2024, and this is the first time for us to work on the HAI. And we have a WASH guidelines also. And you mentioned somebody who, the lady who worked for the WASH in WHO. So we still working on the WASH, and we have guidelines that we try to look at we are now working on the roadmap for the WASH roadmap. So we believe that it can be roadmap, can be support us more how to strengthen the WASH in Cambodia. This is for the second point that I would like to address. And for these points, I think many Cambodian participants who joined this session, I would like to congratulate everyone who involved with the IPC in the whole country in Cambodia. So the success is not from myself, the success from everyone from IPC, every hospitals who involved, who take ownership, who take a very strong coordination to facilitate. I know everyone like try to work very hard. Sometimes they work extra time. Even they finish their working hour from 8 to 5 p.m. But after 5, they still working for the IPC. So I really appreciate everyone so much to get success for this one. I'm just only, to present this success, but the implementer is not me. The implementer from the hospital who make this success. So the one is about the strong leadership commitment. So the leadership from 2023 during the COVID until now, our leadership, our program still running. Our task force still continue. We don't stop. It doesn't mean that the COVID stop and we stop. No, we still continue. So we continue with different aspect, different activities, not just only the, under IPC, a lot of things that we work. We're working on the HAI, we're working on the CSSD, we're working on the surgical site infection prevention. So, and be working on the patient safety. So a lot of things that we still continue under this strong leadership. The national IPC action plan that we are going to move forward based on WHO global action plan, and we modify it. We just adopt to Cambodian context. So we pick up some theme that can be applicable for Cambodia. And the third point is about the support for WASH that I said. We have WHO support it. We have the UNICEF that support the program. Now I think we try to produce the facilitators, the TOT, who can continue, who can scale up the training for WASH to other hospitals. Yes. So this is just the result I would like to present to everyone from Cambodia also. This is your result, the IPC program. The joint evaluation in 2024. From WHO, they did every 2 years. So this is the result IPC program, level 3. And we move from level 1 to 2 and to 3 to 24 and level 3. HAI, we lucky we can gained some scoring also because your hard work and your commitment to work for the HAI. So we move from the number 2, level 2 to level 3. But in terms of the health in safety environment, we still limit to level 2. So we will work more on that. So this is the international health regulation based on the assessment, self-assessment. So we score about level 4 in terms of the IPC program. So why we give us the level 4? Because of the national IPC guideline revised and integrate IPC COVID-19, and we integrated the IPC for COVID into our guidelines also. And we have IPC curriculum, not just only the in-service training, but we have the pre-service training also. And this is the self-assessment also for the health care associated infection. We still level 3 for the international health regulation that we evaluated, because we have system and we plan to work on this is why we work on 11 hospital, because we look at the hospital where they have microlab, and we will continue to next without the microlab. And this is for the safe environment that we discussed before. So you may read this slide and I can share with everyone. So this is another point is developing this effective IPC program. So we look at the HAI guideline, we look at the policy and procedure for IPC, and this is very important, the policy and procedure for the IPC, because the hospital require by the CHAS, the accreditation standard, Cambodia accreditation standard, who stated to require to be implement, develop the policy and procedures for IPC. And also, I think this is a very important day, how we can make every healthcare personnel to behave a positive attitude, to be not the whole everything for IPC, especially for the hand hygiene. Yeah. And this is a training healthcare workers that we would like to sustain it. And we have the IPC guideline, we have curriculum, pre-service training, we have the IPC measuring impact of IPC training, and we build the capacity for the safety, and also the training IPC professionals. So this is on our track that we are going to do it. And this is the one of the point that we're working on in 2024 about the coordination of the IPC. We started the first in I think the second one, the first one in the end of the 24, and the second in the early 25, and we are going to do in 23rd the third one again in next month. So we're looking for the leadership, we're looking for the policy surveillance. So this is what we discuss about during the coordination of IPC. So very interesting when we discuss together. And this is the culture of safe and openness and how we can make people to be ownership. As I said, some hospital already move forward. They put themselves to be owner, and they can support the hospital very great deal, because they can save, when you look at the IPC related to the AMR, the hand hygiene related to AMR, some antibiotic prophylaxis. So this can be save a lot of money for the hospital. During the 24 and 25, we start in the end of 23, 24, we found out some interesting and save a lot of money for especially for the antibiotic prophylaxis. So, and this is a challenges, and I think we need the support again from everyone who involved with IPC, from the national, the subnational, and national level, and also from WHO, how to deal with this limitation. The first one, I think, the limited resource is we don't have enough the trained IPC staff. Sometimes they retire, sometimes they still working on the new one. They come in, they have no involved a lot with IPC yet. So this is, I think, a very challenges for us. And lack of the funding to support for IPC supplies, I think this is a need to be considered. And isolation room, we still facing some hospital, they cannot isolate. Suppose like a multi-drug resistant, they cannot isolate to the isolation room alone. They need to be cohort in some places. Yeah. The second challenge is about the training awareness. We still, I think maybe we can look more deeper why the low awareness of important IPC. Some people, they talk about the IPC everywhere, but in terms of implement, so we need to consider deeper how we can make to be awareness about that. A lack of the full training IPC program, I mean a full program, not just only training and how we can implement it in the future, because some training without coaching, and it can be your lack of the implementation also. The third one is about monitoring and compliance issues. We are difficult about to monitor IPC practice, because it can be, especially for hand hygiene. We are difficult for us to observe it. We try to do it, I think in 24, we try to observe directly, but it take time and financial consumption a lot. The limited capacity for evaluate IPC effectiveness. We want to improve. We want to prove everyone to see this is the IPC can be effective, can be the positive outcome to the patient. So we still struggling, and we try to get a way how to get some important key points to present. This is the effective of the IPC program that is affect to the patient outcomes. And the last one about the data management and surveillance gaps. So we lack of the system. I think WHO in Cambodia try to help us to work on the system, develop a new system, but we still limit of people who can access the system. And analyzing the HAI case, we need to be considered in future. And the data is not in our hands. It means that it can be delayed in feedback, because data is very important. we use data to develop the implement plan or improvement plan, but we don't have data enough to present to them. So this is I would like to present the best practice for us and the challenges. So I would like to stop here on my presentation, and thank you so much. And I would like to thank again for our audience healthcare worker who involved with the IPC that you make this success. And I would like to express sincere thanks also the regional office, Dr. Lee and Dr. Kubota, who support us in terms of the IPC implementation, and Dr. Wanda in Cambodia, who the focal point for the IPC from WHO in Cambodia, and everyone who involved with the IPC implementation. Thank you so much.
Thank you so much, Dr. Veria, for your very insightful presentation and the sharing of your learning and reflections. Now let's turn to Japan, where we will hear about IPC advancements. So Japan has long been a leader in healthcare quality and IPC, and we're very eager to hear about their experiences and the innovative approaches they've implemented. So now today we're honored to welcome our speaker from Japan, Dr. Shinichiro Morioka. Dr. Morioka is an infectious disease physician at the National Center for Global Health and Medicine in Tokyo, Japan. He's a board certified in internal medicine, infectious disease, and pulmonary medicine. He has been very experienced and actively contributed to a lot of IPC strengthening work in Japan and also in low middle income settings across the region. And in addition to his clinical practice and training activities, Dr. Morioka has been involved in supporting a lot of IPC policy and strategic implementations. He co-authored a WHO publication building on effective IPC system in Japan, a historical review, which examines the evolution and strengthening of IPC systems in Japan. So his presentation today is titled Establishing an IPC System in Japan and Implications for Other Countries. Dr. Morioka, the floor is now yours.
Thank you very much, Dr. Lee. I'll share my presentation. Are you able to see my slides well?
Yes, Dr. Morioka, please go ahead. Thank you.
Yeah, thank you. The title is Establishing an IPC System, as Dr. Lee mentioned. I'm Dr. Morioka from NCGM, Japan. This is WHO Global Action Plan and Monitoring Framework on IPC. It has comprehensive list of actions, indicators, and targets for national, subnational, and facility level. As Dr. Kubota mentions, each item is very, very comprehensive and important, but they need to be combined. So today I'm going to talk about how Japan has experienced some of the processes and how Japan has combined some of them. This is a historical review of how Japan has established its IPC over the past 4 years, lessons learned, barriers and challenges, as well as the implications for other countries. There are 3 phases in the history of establishing the IPC system in Japan: pioneering period, development period, current situation. Pioneering period till 1990. Public concern about infections grew after the emergence and re-emergence of infectious diseases were recognized as a new threat. For example, methicillin-resistant Staphylococcus aureus or MRSA. There's some of the big outbreak in the Japanese hospitals due to MRSA. The Japanese Society for Infection Prevention Control was founded in 1986. It was open to doctors, nurses, pharmacists, clinical lab technicians, and hospital administrators who were interested in promoting IPC throughout Japan. It's a multidisciplinary approach. Development period from 1990 to 2010. Human resource development, it's very important. There are some IPC related trainings and educational programs. Due to that, multidisciplinary certification schemes were made, such as infection control doctors or infection control nurses. In addition to that, the field epidemiology training program has been established. It was to respond to the need of prefectures to implement IPC measures in accordance with the Infectious Diseases Control Law. The Ministry of Health provided financial incentives as well as the first medical reimbursement for nosocomial infection control in 1996. As you may note well, changing people's behavior was very, very difficult. But I think looking back, medical reimbursement was a good way to promote IPC in healthcare facilities in Japan. The next one is the Infectious Diseases Control Law in 1998. The national and local governments, along with other relevant organizations, should work together to prevent the spread of infectious diseases. The government was required to improve the surveillance of infectious diseases outbreak and share the results with the public as well as the medical professionals. With that law, two surveillances started. The Ministry of Health organized the Japan Nosocomial Infections Surveillance, or JANIS, in 2000. It provides basic information on the incidence and prevalence of nosocomial infections and antimicrobial resistant bacteria. The other one is National Epidemiological Surveillance of Infectious Diseases, or NESID. Clinics and hospitals are required to report information of the multi-drug resistant pathogens as well as the key patients' information. Those are the list of notifiable diseases caused by the drug-resistant pathogens. The infectious diseases were categorized from 1 to 5, and those are the category 5 diseases. Some of them are notifiable diseases, and some of them are sentinel for notifiable disease surveillance, and those are for sentinel surveillance. Current situation, 2010 to present. National Action Plan on Antimicrobial Resistance started in 2016. There were 6 components in it, and infection prevention and control was one of them. It's a network, community network with the additional healthcare reimbursement schemes. It accelerated inter-facility and inter-community cooperation. Specifically, community networking, including long-term care facilities and clinics, was very, very important. During the COVID-19 pandemic, the IPC in long-term care facilities was a big challenge. Most workers in long-term care facilities had limited knowledge and experiences related to IPC. In addition, inpatients and residents at long-term care facilities are vulnerable to infections. So the long-term care facilities were involved and included in the network, and we have a network just like this, and we have 4 meetings a year with other hospitals, clinics, long-term care facilities, and healthcare centers. So it's a big community and network. It's a very good system for future pandemic. The other surveillance system, it's a Japanese surveillance for infection prevention and healthcare epidemiology. It started 2019. It plays a role in building a national database. It imports data from JANICE, so it has interconnectivity among surveillance systems in Japan. It enables users to visualize and utilize data on IPC. Lessons learned are key factors necessary for the implementation of a robust IPC system. Human resource development, it is very important. Infection control nurses function as the core of IPC in the clinical setting. It's a multidisciplinary collaboration. Once it's developed, the next step would be stakeholder collaboration and networking. Strengthening network is key to promoting information sharing and preparedness for future pandemics. Momentum, public concerns about nosocomial infection and advocacy by the medical community and academic societies helped build momentum that influenced the Japanese government. The last one is healthcare reimbursement scheme and financial incentives. Adding policy-based economic incentives and penalties through the healthcare reimbursement scheme accelerated the implementation of IPC measures in Japan. There are barriers and challenges. Due to limited budgets, it has been difficult for some facilities to deploy dedicated infection control personnel. Much work still remains in terms of organizational developments and team building. Sufficient IPC measures have not been implemented in some of the healthcare facilities, such as long-term care facilities. It's a big challenge. This is the last slide. This is about, this is an example of IPC implementation plan for, for other countries. Most importantly, the short term should be human resource development. Once it's done, the next step would be stakeholder collaboration, networking. And the next one is infrastructure development, such as surveillance system. Economic incentive to ensure implementation based on laws and regulation is very, very important to move each process forward. Thank you very much. That is all for my presentations. Over to you, Dr. Lee.
Thank you very much, Dr. Morioka, for your generous sharing. Now I will hand it over to Dr. Shogo to steer the next session.
Thank you very much for both Dr. Viria and Dr. Morioka. So the floor is for everyone for any questions for either Dr. Viria or Dr. Morioka. If you have questions, please unmute yourself and ask questions.
Can they unmute?
Okay. Okay. Please, or you can write in the comment in the chat for Q&A. Okay.
So yeah, so we have one question here. This is from Tomnoy Sakar. First question, yes, I will just answer you. It's possible to get the recordings and the slides. Thank you for your interest. The second is that, is there any session in upcoming webinars for IPC in the community settings, especially outside of the healthcare settings? We can consider that. Yeah. Thank you for your suggestion. Any other questions?
In terms of IPC outside of hospitals or healthcare settings, I think Dr. Morioka, you mentioned and shared your experience in Japan around coordination and a network with long-term care facilities. And also for Dr. Vidya, you are mentioning about the committees, national committees. So if you have any tips for building this network and coordination, that you could share from either side of you?
So
Right.
yeah, I think maybe I start first, and then the colleague from Japan maybe cover all that. This is just only say experience with what we have working on the coordination of IPC. You know, before we have different partners who involved with IPC. This one, another partner working on another aspect of IPC. So we are sitting in the MOH, we are difficult. We don't know. Sometimes we are working like a double. And sometimes we don't know somebody who work on that already. So the coordination, the benefit of coordination, that we can join everyone, we can invite everyone to sit in the table, the one table, and we discuss which part of the IPC they have done, which are they want to go together, and which one is our plan to move forward. So then it can be, you know, everyone can be have the same voice and the same activity, and sometimes we join activity together. So this is the benefit of the coordination. And I suppose in each hospital, maybe I think this is because in Cambodia we have a small, around 131 hospitals. In Japan is a big, but we need to be sometimes needed to coordinate some, because we need to involve IPC, not just only one the IPC nurse. It must be some from the medical team, from the lab team, from everyone who involved that. So need to be coordinated one and then work together. So this is a perspective that we, this is like a baby, I can say like the baby step of our coordination. Working with Dr. Kubota also.
Okay, thank you. Thank you very much, Dr. Vidya. Dr. Morioka?
Yes, thank you. I have two tips for that. And the first one is that as we did the healthcare reimbursement scheme should involve long-term care facilities as well. This is the first one. And the second one is that it is very, very important not to bring about IPC manuals or guidelines, which are for acute care hospitals. You know, the guidelines or manuals in acute care settings are based on, you know, much human resources as well as, you know, much physical resources. So long-term care in long-term care facilities, the, you know, human resources and physical resources are very scarce. So you know, I'm working at acute care hospital, but I make it a role not to bring about those guidelines or manuals in the long-term care facilities. That's the second point. Thank you.
Thank you very much, Dr. Morioka. Due to the time limit, and sorry for our time management, but we should for today we should close. There are some good questions coming up, so we will address them in the next sessions. And as Zhao has mentioned in the beginning, this is a series of webinars, and then it's flexible. So if you have any questions, suggestions that you want to raise in this series, please do email us, and we hope to have this as an interactive session as possible. Today, because it was the first time, so it took some time in the beginning, but from next time we have more time for interactions. So thank you very much. So just two learnings that I just heard from two of you, and one is about Dr. Vidya. You mentioned in a challenge, for example, about the resource limitation. I think both of you did, but by having this strengthening coordination, you have been leveraging the existing resources, and also for Dr. Morioka about adaptation to long-term settings. So we have just got the question about what about IPC in the community. They're having a discussion around the IPC, the patient safety in the primary care levels as well. So I think adaptation is another topic that we should be discussing over the next coming series. Okay, so for today we will end, and we will have again more interactive sessions as in the future, and not only for presentation and discussion, but we are planning to have more continuous development and mutual learning as we go. What are the learnings and application of our learning from this webinar in our country in between these webinars? So looking forward to work with you further. And for today, I would like to close the session. Thank you very much.
Bye.
Bye.
Thank you so much, everyone. Bye.
Thank you.
Thank you, everyone. Thank you so much. Congratulations, Chao and Shugo, all the team. Bye bye.